Okay, so what we're going to do is we're going to turn this gentleman over onto his right side. Okay, so I do need some volunteers. Now when you're doing any kind of log roll, you need to have your tallest person at the shoulders and your shortest person at the feet. You all need to be one side, and I need one person to check pressure areas, but I'm not asking you to take his trousers down and do check his pressure areas, okay? It'd be too embarrassing. Okay, so I need one more person, in fact 2 more people. So you can observe pressure areas. Okay, now I'm shorter than you, so I need you in the middle. So what we need to do, we're going to turn you over onto your right side. So obviously explain to your patient what you're doing. As you're at the head of the patient, you'll be taking the lead. Okay, so when it comes to doing a log roll, you can put your patient's hand up there like that, because that way he's not going to lie on his shoulder. If you bring this arm across the chest, like so, you will be supporting that shoulder, and you'll be supporting the waist. No, we don't bend the knee, because if we're worried that you've got a back injury, then we need to keep your legs straight.
In Spain, bend knee?
Yes. Yeah. Not if it's for the recovery position, yes, but if we're querying that you've got a spinal injury, if we bend your knee, we may make matters worse if you've got a spinal fracture, particularly if it's unstable. So we never bend the knee, we'll keep it straight. If we're going to the recovery position, yes we do, but for a log roll for a spinal injury, we don't. We keep the legs straight, okay? So you'll be supporting the shoulder and the waist. You will then be supporting the hip and the knee, and I will support the foot, okay? So if you'd like to just get yourselves into position, let me just raise this bed up because it's a little bit low. We need to protect backs. Okay.
Your back is very important.
Thank you. Okay. So if you'd like to get yourselves into position for me, that'd be lovely. Okay, and then I support that way. And on your safe so we go on. All you're going to be doing is checking pressure areas or checking his back to make sure there's no grazes or anything on his back. So on your say so, Alessio, okay?
Okay, I like to do, where is the phone? What is the phone?
Ready, it'll be ready, steady, roll.
Ready, steady.
Okay, and you keep the back in a nice straight position, like so. Okay, so you could then check to see if there are any injuries, if he's got any lacerations or any broken glass or anything. And then when we're ready, we go ready, steady, back.
Okay, ready, steady, back.
Keeping the back in a nice straight position all the time. Okay? And ideally your patient should feel confident with what you're doing and not feeling as if they're falling out of bed. How does that feel? Good.
Can we